Okay, it's 7:30, so we will get started. Welcome, everyone, um, to this is our last regular session of our unmounted program, Zooms this winter. Um, I want to thank, as usual, Mary Livernoir, that you all have been hearing from, is organizing, along with Susan Sieber and Carol Baker. We certainly couldn't do this without them. Also want to thank the Connecticut Dressage Association for their sponsorship, and Trafalgar Books, who've been sponsors of Dressage4Kids, I think, from just about the very beginning. There will be a drawing for a gift certificate to Trafalgar horse books at the very end of the program. I also want to point out quickly two other unmounted sessions that are coming up, and you can find these on the website. I won't go into great detail. There's an amazing day planned at Tufts University in Massachusetts. I think there are 5 or 6 people lecturing, and you get opportunities to see how the various machines work and so on and so forth. Again, find it on our website. It looks pretty exciting. And we also have another Zoom session called the Taste of the L program. This is the L program. Did I say that right, Mary?
Yes, that's right. Yep.
It is a Taste of the L program in conjunction with USDF. As far as tonight, if you have questions, please write them in the chat. And our speaker is perfectly happy to be interrupted. So Mary or I will interrupt her with questions. So do write the questions in as they come up, and we'll try to get them to Heather as promptly as we can. So our speaker tonight, Dr. Heather Beach, who grew up in New England, horse crazy kid, like many of us. She showed in dressage, jumpers, and some eventing prior to pursuing her career in veterinary medicine. Since graduating from Tufts University in 2007, Dr. Beach has continued to have her love for the horse and the equestrian sports which guide her career. She founded HB Equine Services in 2022. This is located in Ashford, Connecticut, and provides high-quality sports medicine diagnostics and treatments to her equine clients. Dr. Beach can often be seen helping her partner, J.J. Lavieri, at horse shows, setting jumps, grooming the horses, as well as taking care of their healthcare needs. She competes in jumpers and in dressage, and also enjoys bringing along young horses and ponies for resale. So with no further ado, I turn you over to Dr. Beach.
All right, guys. So I'm telling everybody, pardon the ambiance back here. I'm a true road warrior today. Today is the beginning of my annual migration back from Ocala, Florida, back up to New England for good. So I'm driving, and I pulled over here in a lovely McDonald's parking lot to use their Wi-Fi and give this presentation to you all. So it's a cool topic, equine tendons and ligaments, but it's not very dense for once. I don't have a million slides full of too much information. So certainly if you want to veer off of anything that I have on the slides, just jump in, ask questions, interrupt me. It's totally fine. We should be able to get through this pretty quickly. All right. So as long as I can get the slide to advance, come on, there we go. Okay, I went too fast. Okay. So I need to get my little thing out of the way of my slides so I can see things. So basically start off, as most of these presentations, with the definition. What are tendons and ligaments? Tendons and ligaments are basically the same thing. They're made of the same stuff, but by definition, a tendon is a structure that's going to connect muscle to bone. So you can see on this picture on the left, we have a muscle belly that ends in this long fibrous cord, and that is attaching onto a bone, versus a ligament that connects bone to bone. So this happens to be the suspensory ligament, and the origin of this ligament is up here on the distal row of carpal bone. So this is going straight from a bone onto the sesamoid bones down here. So from bone to bone. That's really the only difference between a tendon and a ligament in reality. It's kind of a definitional thing. what is the importance of the tendons and ligaments in a horse? They rely obviously on their tendons and ligaments for every movement that they make, whether it's running, jumping, or walking. And this is part of why horses are so, graceful and beautiful in their movements, because they have such long and efficient tendons and ligaments to help move their legs along. So what's the form and the function of it? If you start to look at a tendon or ligament, under the microscope, you twirl down smaller and smaller and smaller. It's made of these little collagen fibrils, and they are kind of like, a bunch of fibrils come together to make a fiber, and then the fibers go in a bundle to make a subfascicle, and then the subfascicle becomes a fascicle, and then you get a fiber bundle, and then as you grow outward and outward from that, you get a tendon. And this is one of those like beautiful works of nature that you couldn't design it as efficiently in a lab. This is just millions of years of evolution has designed this to have just the right properties of strength, and elasticity, and to function the way that the animal needs. So this design, these fibrils, fibers, subfascicles, fascicles, bundles, tendons, they are what provide the strength and the elasticity to that structure. And then those fibers just within the body, surrounded by a matrix of proteoglycans and elastin, that help to also support and keep the tendon flexible and resilient. Proteoglycans, I put that big old word in there because this is some of the things, the joint supplements that we like to support our horses with. Equine is a polysulfated aminoglycan pisgag. That's kind of the shortcut for it. Things like that, those will help support collagen and tendon health, those kind of products that we use all the time. So how does a tendon work and how does it function? There's a lot of stretching under load. So when the horse's muscle contracts, it pulls. So we're talking about tendon specifically. Same idea happens in a ligament, but especially with a tendon where it's muscle to bone. When the horse muscle contracts, it pulls in the tendon, causing it to stretch. The stretching allows the tendon to absorb and store elastic energy created by the muscle contraction. So when that tendon elongates in response to the applied force, that allows the limb to move. So I have this little picture of springs here. That's basically how it's working. Think about a rubber band. You pull it, you stretch it, and then you snap it, and it releases all that energy. And this is, from an evolutionary perspective, this is a very efficient way to have a body move and to take all that energy generated by the muscle mass and maximize the movement per unit of energy created in the muscles. This is kind of a dense physics concept. So there's a little, the science behind it is very physics based. So if you haven't got to that part in school yet, you might not understand the mathematic behind it. But I think conceptually, the Boingy springs is what you need to think about to understand how this works. So again, as the tendon stretches, the collagen fibers will straighten. So they're kind of all coiled up like a tight spring. They straighten as it pulls and stores the energy, and then when you let it go, boom, that's how you get your movement. This picture here is pretty interesting because we see a horse and you can see how far down that fetlock is sinking. And remember, all the tendons and ligaments are on the back of this horse's leg. So having that much movement in the back of the leg, that's how straight and how much tension those structures are under at this maximal moment of load for those structures. So as straight as all those little fascicles can get right there, really stretched out long, and then boom, it's gonna release and propel the leg forward. So again, when you have that release of the elastic energy, see, now there's no tension in these tendons and ligaments in the back of the leg. The force is removed because the muscle relaxes or the limb completes its movement. That elastic energy that is stored is released, and then the collagen fibers recoil back to their original position, pulling the tendon, and then when it gets to the medium load, taut again, basically, or neutral position. So again, this is a very efficient way of transmitting the force. The elastic recoil of tendons allow them to act like springs that efficiently transmits the stored energy back to the bones and muscles. This helps reduce the metabolic cost of movement by minimizing the amount of energy required for muscle contraction. So that's how evolution kind of did this. Evolution is always trying to, find the most bang for the buck. So for whatever unit of energy from, feed conversion, converting feed to movement, however it can do that the most efficiently. And for a prey animal like the horse, that needs to be able to gallop and move fast to escape predators, and then obviously now we're purpose breeding them too. So we've kind of we go to the evolutionary beginnings of horses, which created them one way, and now we're line breeding them and purpose breeding them. We are enhancing the traits that evolution gave the horse. They become even more efficient. They become faster. The race horses become faster. The jumpers jump higher. The dressage horses have more extravagant movement. And all of this is due to how efficiently wonderful the tendons and ligaments work when they're working, when they're not pushed to the maximal strength. So also these tendons and ligaments are going to take some of the brunt away from the muscles and the joints. So they're going to act like little shock absorbers too, when they take some of the force of the horse's body, like this little cutting horse is doing here. There's a lot of torque on those joints and ligaments and joints and the muscle bellies and stuff here. And those tendons and ligaments, if they're strong and they're healthy, they're going to keep everything from falling apart, basically. So a movement like this, you've got some collateral ligaments on the sides of the hocks and the coffin joints and the fetlocks. Every joint has a collateral stabilizer on either side of it. Those ligaments, bone to bone, they're going to be above and below the joint, and they're going to stabilize that joint from side to side when the horse makes movements like this. So again, just a big part of how horses work is their tendons and ligaments do this job for them. So again, I think the big take-home message from a biomechanics physiology perspective is that the elastic recoil of the equine tendons is their vital biomechanical property that enables efficient movement and locomotion, allows the tendons to store and release the elastic energy, contributing to the horse's agility, performance, and overall musculoskeletal health. So now we're going to talk a little bit more directly about a couple of the specific tendons and ligaments. So, we all hear about the suspensory ligament. Oh no, my horse had a suspensory, or he did a suspensory, or he injured the suspensory. What is that ligament? This is one of the really important ones. This picture is showing you a front leg suspensory ligament. We already saw this before. So this is the origin of the suspensory. This is where it starts. And this is where, if you're going to have an injury in the suspensory ligament, most of the time, it's going to happen up here at the origin. This picture actually shows that, let's say there's a lesion right there. This is a place where it could be injured. And I like to think about the origin of the suspensory ligament kind of like, this is going to sound a little, I don't know, maybe this isn't the best analogy, but it's the best way I can describe it. If you're eating a steak and you kind of pull that steak off the bone, off of a piece of bone, and you kind of feel the way it's cooked, so it's a little differently, but you feel the way that pulls off against the bone. That's what can happen to the origin of the suspensory, where it's attaching onto the bone. Either that attachment, that sort of periosteal attachment onto the back of the bone, can kind of peel back. Sometimes, if the ligament is very strong, the weak point can actually be the bone itself, so they can get a little chip off of the back of the cannon bone there. And they call that's called an avulsion injury at the origin of the suspensory, where the ligament itself was strong enough, the bone actually broke a little piece there, and that loosened up the top of the suspensory. Those horses tend to do really well because actually bone heals much better than tendons and ligaments. Because one of the things, and I forgot to mention this and put this in the slide, if you think back to all those fascicles and bundles and things about the tendon, there's not a lot of blood supply in equine tendons or ligaments. So that's part of the challenge for healing injuries there, is that there is not a very good blood supply. And so anytime there's not a lot of blood supply, you don't get a lot of oxygen, you just don't have a lot of healing opportunities. So that's another feature of equine tendons and ligaments. They're amazing, they're wonderful, but when they are damaged or injured, they're much slower to heal than bone or muscle or skin, or even organs. Like, if you have damage to the liver has tons of blood vessels going through it, so it actually heals itself relatively easily. This is tendons and ligaments do not have good blood supply by nature, so they are very slow to heal themselves. The next most common place to see an injury in the suspensory ligament is down here. These are called the suspensory branches. So there's a medial suspensory branch and a lateral suspensory branch. This is the lateral one, that's the medial one. And right here where it branches, this is down around at the level of the fetlock. It can be fairly common to see injuries in this area of the ligament as well too. Yeah, so I think that's about the suspensory ligament for now. What does the suspensory ligament do? It is one of the primary functions is to provide support and stability to the fetlock joint itself and the structures within the lower limb. So it maintains the alignments of the bones and prevents excessive movement or hyperextension of the fetlock joint during weight-bearing activities such as walking, trotting, and galloping. Now, obviously, when they gallop, there is a tremendous amount of hyperextension. We've all seen that picture of the racehorse when they're in the full gallop and that fetlock is basically touching the ground. So that's maximal exertion, maximal loading, maximal stretching of the suspensory ligament. We saw that to a certain degree in that dressage horse that was doing an extended trot, that there was a lot of fetlock hyperextension in that movement. So, every time we do that, the more we're stretching that ligament, the more that we're asking it to do, the harder we're asking it to work for us. And the more we're setting it up to potentially have repetitive strain injury or a true actual tear. This picture here, I borrowed from SmartPack because they had a nice little article about DSLD, which is a degenerative suspensory ligament disease. Not really an acute injury, but an accumulation of injuries. And this is apparently the same horse before and after the onset of DSLD. So here, these are hind suspensory ligaments. So this is a relatively normal looking hock angle. The fetlock is nice and upright and supported up in the air as it should be. And then as that suspensory ligament has started to degenerate throughout this horse's life, now the hock is basically straight up and down like a stovepipe. There's no angle to the hock anymore. And that fetlock is just dropping all the way to the ground, no support, because these hind suspensory ligaments just are not suspending anymore. They're basically gone. So that gives you a very strong illustration of exactly what that ligament is supposed to be doing to help support the normal leg. That bit of an extreme example, but it's a good visual for people to see what would happen if you didn't have a suspensory ligament. Again, it's going to work for as a shock absorber. It's going to dissipate some of the forces generated as the horse's foot makes contact with the ground during locomotion, reducing impact on bones, joints, soft tissues of the limb, and hopefully going to help prevent injuries to other structures. Again, it's incredible how much that ligament can stretch and how much load these horses, when they're doing their athletic things, how much force is being concentrated right through this fetlock joint and in all the work that that the ligament's doing. Obviously, in this case, the tendons back here are going to be doing some of the work here too. But for sure, when you are in this hyperextended fetlock stage, your suspensory ligament and branches are really getting a workout in that scenario. So what else can it do? I think we kind of already talked about this. Yeah, kind of distributing the tension from the body through the limbs, flexibility and range of motion. So this is also going to be responsible for the range of motion of your horse's fetlock joints. Some older horses will get a little bit, I want to say, frozen there, where they lose a bit of range of motion. That can come from some chronic scar tissue around those suspensory branches. Sometimes that's just joint capsule from the fetlock joint itself too. But certainly having healthy suspensory branches and a healthy suspensory ligament is going to help the horse have normal range of motion in their fetlock. And a good healthy suspensory ligament is going to help protect the flexor tendons that are also running on the back of the leg as well too. Okay, so then we're going to talk also specifically about those flexor tendons. So this picture kind of shows you all three structures together. So the flexor tendons are called the superficial and the deep digital flexor tendons. So the superficial is shown here in yellow. And remember, this starts as a muscle belly way up here in the horse's forearm. Then it becomes a tendon right around this level. And so it's starting as a muscle and it's inserting onto a bone, and it inserts down here at the top of P2 and will help. So how you can tell what this tendon does, as you have to picture, if this shortens, it's going to pull from here, basically from the mid pastern up. So that's going to help bring the leg up. The deep digital flexor tendon, again, starts up here in the forearm as a muscle, turns to tendon right around here, and this one inserts all the way down at the bottom, runs under the navicular bone, and inserts at the onto the coffin bone down here. So not only is it going to, help flex the fetlock and the carpus here, but it also has the responsibility for flexing the coffin joint as well too, because this one goes all the way down inside the hoof all the way to the bottom. And then here we see the suspensory ligament, which is deeper than the deep digital flexor tendon, running in here, attaching onto the top of the sesamoid bones, and then it does have these little extensor slips that sneak forward. These luckily don't get involved with too many problems usually. So again, superficial flexor tendon provides support and stability to the fetlock joint and the pastern region while it's weight bearing, assists in flexing the fetlock joint and the pastern, and works in conjunction with the deep digital flexor tendon to also absorb some shock so that the suspensory ligament doesn't have to do it all by itself. The deep digital flexor tendon, deeper to the superficial, does kind of all the same things that the suspensory and the superficial are doing, but also in getting involved with the coffin joint and the structures within the foot. So now we're going to talk a little bit about injuries. This is a picture that these are cases that I have dealt with myself. So this is an older mare actually, and we find this actually happens a lot in older horses. I think it's just some age-related change, probably accumulation of micro injuries, micro tears, and they don't actually have to do anything super exciting. This will happen a lot just in standing around and turnout in older horses. Maybe they have Cushing's and their ability to heal from the normal micro traumas is not good. But so this was an older mare and she got a core lesion here. So this is an ultrasound image of the tendons and ligaments. This up here is her superficial flexor tendon. This right here is her deep digital flexor tendon. This is her check ligament. I didn't really talk about the check ligament too much, or I didn't at all in this talk. And then the suspensory ligament is deeper here, and we're not really showing on this picture. But the point of this is to zoom in here on this superficial flexor tendon. Right here is a true core lesion in it. And then we look at that in two different planes. So the way that this was explained to me of how to visualize, how to look at an ultrasound and understand what you're looking at. If you picture that you had like a long tube of spaghetti, which here, I'll use this can of Celsius. This is my tendon. If you look at it this way, that's this image. This is the cross-sectional image. So now we're looking at the structure of the tendon in this direction. And then when I flip my probe and I look at it the long way, I can see that the tendon fibrils or the ligament fibrils running this way. Okay, so cross section, longitudinal, and that's how we're looking at this particular injury in this superficial flexor tendon. So this black hole here shouldn't be like that. It should look nice, long and straight like that, with the tendon fibrils going across the screen, looking healthy and normal. And this black stuff here, that's the damage, that's the injury, and that's the scar tissue that's filling in. So how do we get tendon and ligament injuries? It can be from overexertion, intense exercise, or sudden increases in workload without adequate conditioning can strain tendons and ligaments. That's why you never want to, your horse, it's winter. Right now is a perfect example of this. We all think we're going to work when it's freezing cold and when it's windy and all winter, but then the horses are fresh, they didn't go out, they're too wild, and so maybe they didn't work as hard over the winter as we thought they would. So now the weather gets good, we're all excited, we're thinking about horse shows, we want to get to it. Well, if you don't recondition your horse after the time off, and they are fresh and they are wild and they are silly, then they're not going to be, those tendons and ligaments aren't going to be as strong as they need to be to withstand the big movements, the huge hyperextension, and that's going to predispose them to an injury. Especially the older that they are, that's the more they're going to need a more gradual return to exercise after they've had some downtime. Trauma can certainly injure a tendon or a ligament, whether an actual laceration. One of the worst lacerations I ever saw was a young horse that, we all do it. You're cleaning the stall, you put the wheelbarrow in front of the stall to, block the door. You're doing the stall with the horse in there, and this baby horse just went and pawed the wheelbarrow, and he severed his superficial flexor tendon on a sharp edge on the wheelbarrow, like where the wheel goes. It was really, really sad. So they can lacerate them, but a kick to a tendon or a ligament could damage it as well too. Then poor footing, slippery, uneven surfaces increase the risk of tendon and ligament, because again, these fascicles, these fibers are all supposed to be going in one direction, and they're supposed to be supporting the horse in one direction. Yes, we have that catty little reiner that was going in all sorts of sideways directions, but that's a very specific sort of discipline that the horses are kind of trained up for. But that certainly, those kind of movements those sideways movements are gonna stress those ligaments in ways that they're not really used to. And so that's where the sort of bad step, the slip in the paddock can result in extra strain. We think of extra deep footing as being potentially more problematic for soft tissue injuries. That's we call tendon and ligament injuries soft tissue. So if the footing is sloppy, if the footing is deep, if the footing is uneven, that's when you want to be a little more careful. And I personally have seen more soft tissue tendon injury, ligament issues when we have to have studs in the horse for whatever reason. So if it's wintertime and they are wearing their studs to go out for ice and snow, but they're working during the winter in the normal footing, sometimes that extra traction can increase the chance for a tendon or ligament injury, which is unfortunate because on the one hand, we have the studs in to prevent the slipping in turnout, but on the other hand, it maybe is adding a little too much traction to our riding time. So that's one little catch-22 there. Also, you can have just a horse could be born with poor conformation that over time and over the course of its life could predispose it to an injury as well too. Thinking back on that horse with the degenerative suspensory ligament disease, in general, horses that are naturally having a very straight hock without a lot of angle, and maybe they're like already as a young horse having a kind of a fetlock that wants to be a little parallel with the ground, like already a little low. To me, those ones are definitely going to be a little more predisposed to having a hind suspensory injury at some point in their lives. And then like a very low heeled horse in front, that's going to put more strain and more strain and load on the deep digital flexor tendon. So we can see horses get more deep digital flexor tendon injuries in front if they have a very low heel conformation too. So what are some of the types of injuries? You can just get like a mild strain. So basically stretched it, but then those fibers stretched and they got a little inflamed, a little angry, but they didn't tear. So this ultrasound up here is a perfect example of what I would call a strain. This is a superficial, it's a different ultrasound machine. These are both mine, but this was an older machine, so the quality in the image looks a little different. But this is a superficial flexor tendon up here, and this is a deep digital flexor tendon. The deep digital flexor tendon is normal. This superficial flexor tendon is inflamed, so it's darker, which on ultrasound that means more fluid in there, and there's just these little lines in between the fascicles and the bundles here that I can see. But this did not go on to be a tear. We had to rest the horse. We did some shockwave therapy for him, and we followed him along, and this kind of quieted it down and went back to normal relatively quickly. And then again, this is the same mare as before that had the tear in her superficial flexor tendon. This is an actual tear injury. So, and then we talk about degenerative changes. I couldn't find a good ultrasound image that was one of my own of like a degenerative suspensory, because oftentimes we don't need to ultrasound that. We can see externally with that big fetlock drop, and we know what's happening in that case. That's, a bowed tendon might also be like a degenerative chronic change that probably, so a bowed tendon is basically a chronic inflammation of the superficial flexor tendon. So that's a situation like this that kind of, they don't quite get a hole in it like as big as this, or maybe originally they did, then it filled in with scar tissue, and then it just kind of like never went back to normal. So it's an overstretched chronic tendon. And some of those can do quite well. A lot of racehorses get that. They're not going to be able to go back to maximal exertion with a bowed tendon, so they're done for racing basically, because again, that's maximal load, maximal stretching of that. They will re-injure that if they tried to race on it, but they can be perfectly suitable with enough time and healing or quieting down of that situation for moderate level sport. Some of them can even do, plenty of jumping and things like that, even on a chronic old bow. And, obviously going to be a little bit prone to re-injury, but we know tons of retired racehorses that just go on with their little bowed tendons and never look back. I see two things in the chat. I'm not looking at them. I see there's like two or maybe three. I don't know if we have questions. If I should start.
Yeah, so I don't know if you're going to get to it later. One of the questions is, what is the normal recovery time of an injured ligament?
Yeah, I don't know if I have that specifically in there. I can't remember right now. So it's gonna vary, but a strain like this one, I think, I want to say we gave this one 3 months of like, babying it at like 3 months total rehab time, let's say, where that's from beginning through, we're walking. Probably on this one, I think we just went to tack walking. I don't even know that we went straight to hand walking. I think we were able to keep him going lightly under saddle, building up, adding in a little bit of trot, blah, 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 till you get all the way back up to full work again. So like a strain, a mild suspensory strain, that one might be, depending on how lame the horse initially was and what it does for a living, that might be more like a 6 month rehab program. but again, you're not doing nothing for 6 months. You're like getting your horse fit again, and you're reintroducing work slowly. I'm just saying 6 months from the beginning to the end, where you're like cleared to go back to normal activities. Something like this, a big tear, this is a long one. So this is like 9 to 12 months of like very painstaking, careful rehab. And then once you're back in a year, you're gonna, you know, in this particular older horse, this is probably not really going to heal. She's actually doing really well. I should have put in some of her follow-up ultrasounds. So she's actually surprising me and healing this up quite well with some shockwave therapy. But my thought or my sentiment to the owner was like, she might be done as a riding horse for now, you know, just given her age and how severe this injury was and how likely to re-injure they are. But in a younger sport horse, and we're really going to try to get this one to come all the way back. We're a year minimum before we can really start asking for things. And then, you know, a lot of these ones will re-injure. There'll be a certain threshold that they just can't take. So I've had some of these guys get a year into it, and then they jump that one jump that was one jump too many, say if they're jumping horses, and then they re-injure. Not always at the same place. Sometimes it's somewhere else within the same tendon. So yeah, it's long. For true healing of a true injured tendon, it's a very long time. That's why you're much better off to try to catch these at mild strains and then respect them. Do your time, do the rehab, go slow. 3 to 6 months for most of these, and they're going to come back and they're going to be just fine, and it's all going to work out good. But you definitely want to be patient. The prognosis of the laceration. So that poor young horse did go to surgery, did have the laceration repaired. He was in a cast, and unfortunately, he colicked in rehab and didn't survive his colic. So that particular case was a really sad one. How he was still going to be a little bit of a 50-50 for him too. So they completely sever the tendon. It's not great. It will fill in, and it will fill in with some scar tissue, but and how structurally sound and how much athletic ability the horse will have after that is going to be variable, well, based on the horse. I never say never, because some horses just truly surprise me with their ability to heal and to cope. But it was going to be guarded. Certainly a hind limb. I have seen incidentally on a pre-purchase, I can think of one that had a big old bump on its hind flexor tendons, and I did an ultrasound and I said, wow, this one severed his hind flexor tendons at some point in his life and is all healed in with scar tissue, but that thing was sound and a riding horse and he was good. So again, more prognosis is going to be worse if you sever a front flexor tendon than a hind. But I guess there's always a little bit of hope. And how can you tell your horse needs to be examined for suspensory injury? Will it always show signs of lameness? So there are some subtle signs. We're talking to dressage folks here, so I think especially in the hind suspensory, that can be very sneaky. And it can be very difficult to know if that's what you're dealing with. So sometimes behavior issues, reluctance, difficulties, and I don't want to get everybody paranoid and have you all calling out your vets to look at the hind suspensories right now, because this could be anything, right? But if you have a horse that just is struggling with a movement that involves a lot of loading of the hind leg, maybe starting to get grumpy about it, maybe starting to say, I don't want to. They might be trying to tell you that they're getting sore there. So that's for the hinds. I think the front suspensory ligaments are much more honest, that they will probably limp properly if they are bothered in their front suspensory. If it's both, so sometimes if they're just sore behind, like maybe they're ready to have some joint injections in their hocks or their stifles, and they're not wanting to use their hind end, and they're overloading their front end a bit. We can find just on palpation, they're just a little sore in that area, and they're not injured, but they're, starting to overload in front, and they just need a break, maybe a little help behind. And then that soreness in those front suspensories will go away pretty quickly. And then, so a lameness, so then the classical, way to say like, or to suspect a suspensory is a lameness that's worse on the outside of a circle. It's not, there's no hard and fast rules. That could be anything. You still have to go through your whole clinical exam, do your diagnostics, do some nerve blocks, do all your imaging and things like that. But that's sort of the classical worse on the outside of a circle kind of, loosely, that's going to make you start thinking, is there a suspensory problem here? And then we have, what is the average age that horses start to be prone to tendon and ligament injuries? So they're all horses, just by being horses and being athletic, are prone to having it. But I would say once we start getting into that 12, 13, 14-year-old year, then yes, they're going to be less resilient than the younger ones, and they're going to have more accumulated stress on their tendons and ligaments, probably starting around those years. For the ones that do these sudden, just out of the blue, walking around on their paddock kind of things, that's older, like 18, 19, 20, that kind of age group where they're just like walking around. They're not even bucking or doing anything silly, and they can just kind of have this happen. They tend to be much older. All right, so now that I've scared everybody to death, let's keep going on with injuries. Let's see. Oh, so this was an interesting one. I wanted to put this case in here. So, how do we diagnose tendon and ligament injuries? You need to use a modality that can see the soft tissues. So ultrasounds, and then if you can't find it on ultrasound, but you really think that it's going to be soft tissue, you need to go get an MRI. Sometimes you can see things on a CT scan, and now there's this cool new technology called a PET scan. And a PET scan is kind of like a bone scan for soft tissues and for bone. So I didn't put any pictures of that up on here, but it's a really cool new technology that's out there. But predominantly we're going to be doing this with ultrasound and with MRI. So this was a horse that I examined, and she was lame. And when I did some nerve blocks, she blocked to her heel region. And we did some x-rays, and we tried changing her shoeing, and that didn't get it better, and nothing was getting it better. So we decided to do an ultrasound. And when I did the ultrasound, this is the deep digital flexor tendon in her pastern here. It's a bilobe structure, and it looks like this. It's reversed, so you can see my writing is backwards because it was mirrored from how it was on the MRI study. So I saw this little spot here. I mean, you can see there's lots of spots like that on an ultrasound, right? Like I could make up a spot there. I could make up a spot there. But with experience and time, and when you're doing it live, it shows you a lot more. I just said, this is a little interesting, and maybe this is a little bright, this is a little white, and that's a little dark. It's very subtle. I can't confirm that that's a problem, but let's go do an MRI so we can be sure. And then here we are down here. I hope this shows good for you guys. You can see the MRI shows it clear as day. It also has an arrow with it. That's also great when you get your MRIs back from the radiologist. They put little arrows there for you, and that really makes it stand out. But you can see this black structure is the deep digital flexor tendon, just like it is over here. And what was that tiny little, like missing a couple of pixels there, shows clear as day to be an injury to that deep digital flexor tendon. So this was a horse that needed rest. And it used to be that deep digital flexor tendon injuries were just like, forget it. They're not coming back. They're not going to get better. They don't respond. But we're able to diagnose them so much earlier now. She made a full recovery. She did great. So she rested, she rehabbed, she probably got some PRP in her coffin joint and in her bursa or her tendon sheath. I can't remember. Some shockwave and the time and the rest and the shoeing program, and she made a full recovery from this injury, which is good. Let's see. So, okay. I think this is about, what is PRP? PRP is platelet-rich plasma. So that's something that we harvest from the horse's blood, and then we can spin it in a proprietary centrifuge to concentrate the platelets within the blood. And those platelets carry a lot of really good growth factors. And so then that those growth factors can be re-injected. Sometimes we can put them directly into the the big hole in the superficial flexor tendon. At the end of the day, superficial flexor tendons tend to heal with a lot of scar tissue no matter what you do. So I did not inject PRP into that particular one, especially the older horse. You know, the cost benefit of that for her, I don't think was going to be there. But we can go directly into the actual injuries with the PRP. Or what I do more often is I'll treat whatever the joint that's near the soft tissue structure, or if it's running through a tendon sheath or a bursa, and I can inject it into that space so that it sort of bathes the injury in the good stuff. Then that's how I tend to like to treat those. Yes, and then platelets, yes, they're good for clotting, but again, the reason that they're good at clotting is because they have all these good healing growth factors, cytokines that live within their granules, and they're very magical little things. So so that's one of the cool technologies that we have. All right, so how are we going to prevent our tendon and ligament injuries? Proper conditioning. We gotta gradually build the horse's fitness up through a structured conditioning program. We want to avoid sudden increases in intensity or duration of exercise. This constrain tendons and ligaments. You know, it happens every fall too. Like, oh, it's hunter pace season. Fluffy, I want to go on a hunter pace with Fluffy. Fluffy can go on a 10 to 12 mile hunter pace for sure, cold, not particularly conditioned, but you gotta go slow. Okay, if you want to go on your hunter pace with Fluffy and you want to go run and canter and slop through the mud and jump a couple logs, then you need to ride Fluffy for a bit of time before you go to the hunter pace and go do all that. You can't, it's not fair to them to just go cold out of their paddocks sitting around, not without proper conditioning straight into that. So again, we're in that time of year that we're going to be knocking the rust off. We're going to be getting our horses going again. You gotta do the due diligence and get them back fit properly and carefully. Warm up and cool down. You need your proper warm up and cool down routine before and after exercise. So the walking, I cannot stress enough that walking is one of the best things you can do for your horse. The more walking you can do, you shouldn't be able to hurt them at the walk. And it's going to help their entire bodies. And especially the tendons and ligaments, getting them stretched, getting them supple. Think of it like when you're kneading dough, you knead the dough and it starts off a little stiff and then it gets warm and then it gets a little more pliable. That's what your warm up and cool down period is for your tendons and ligaments too. Regular, consistent exercise. The fitter they are, the more muscle tone they have, then the more proprioception, the more ability to stabilize themselves they're going to have, and the less risk of injury you'll have. Proper footing, safe and suitable footing. And again, we can't all afford $250,000 arenas and the best, most wonderful footing, the most expensive, high tech, this, that, or the other thing. But hopefully we all have a way to drag our arenas. And hopefully we do that. We take the time to properly groom our arenas and maintain the edges. We can all get out there with a rake and rake the divot in the track when it happens. And then if it's a bad sloppy day, we don't have an indoor and there's mud, just be careful. That's a good day to do some walking stuff. The footing's not good because the weather wasn't good. Doesn't mean you can't ride your horse, but it does mean maybe today is a good walking conditioning day instead of a canter pirouette day, whatever we might be working on. Correct shoeing and trimming. Again, keeping on a good schedule, a good tight schedule, err on the side of going too soon rather than too late, because the longer those toes get, the more deviation or flares that they get from not being kept up on a normal cycle, then the more abnormal forces we're going to have on the tendons and ligaments too. That's it. That's all I have so far. So if we have any more questions, fire away.
Any more questions? But I do see a lot of thank yous. Can you see them?
I
Oh, here
can.
we
Yep,
have
yep.
one. Oh, yes.
Oh,
What do you
we got
think
one more
about?
question about polo wraps or
Yeah.
galloping boots. I think polo wraps are fine. So I don't think none of these boots or wrappy things give support. So that's the one thing everyone's like, oh, I want to give fetlock support. I want to support the tendons. I don't think it does that. But what they do is provide physical protection from an overreach. So like a hind leg coming up and grabbing the back of those tendons. I think you can definitely provide protection that way. And certainly from splints and from side, if they're interfering sideways when you're doing your lateral work, you can have some physical protection, probably more for the skin even and the splint bones for some of the sideways stuff. I'm glad somebody asked about boots actually, because I meant to put something in there or try to remind myself to say there's some limited research out there that says that if you over boot and that can make too much heat under the boot, and the heat can contribute to tendon and ligament damage. So especially like the cross country boots where those horses are galloping at, pretty close to maximal exertion over big tracks and doing these big jumps and things like that they want to have airflow and air circulation and some cooling properties within those boots. I think, again, for a high level sport, that probably matters and that probably does make a difference. I think for most of us in the not peak highest level of equine athletes, I think it's still safe to have boots on your horses. I don't think they're going to overheat and cause tendon injuries because we ride them in boots. I think the protection that they offer is good, and I think polo wraps are fine as long as they're applied properly and all that stuff. But I wouldn't be counting on them to support the tendons, but they're offering physical protection against trauma for sure.
Well, thank you very, very much.
All righty.
That was terrific.
Okay.
And safe travels. I'm going
All
to
right,
be
thank you so
following you
much.
up in a couple of days.
All right, take care.
Okay. Good night, everybody.